Hello, bonjour, namaskar. I am Dr. Nandini Gokulchandran, the Deputy Director of Neurogen Brain and Spine Institute. I welcome all parents, professionals and participants of this webinar on recent advances in treatment of autism, cerebral palsy, intellectual disability, Down syndrome, other neurodevelopmental conditions, as well as conditions of the brain such as paralysis, stroke, spinal cord injury, head injury. And what is new here now that we can do for these patients. So, I'm bringing this seminar from Neurogen Brain and Spine Institute, which is in Mumbai, India. Why are we here? We are here because either we have a child who has a problem, or we are caretakers of an adult who has a problem, or we are professionals, therapists and doctors treating patients of various neurological disorders and wanting to know what best can we do for our patients, what more is there to offer to help improve quality of life of these patients. So, what has happened so far? If you are a parent of a child with a neurological condition, generally what are you doing? You are running from pillar to post. You visit doctors, you visit therapists, sometimes you get a diagnosis, sometimes you say there are symptoms, there are different assessments done, maybe some tests may be done, but finally you are told that there is no cure, there is no treatment, you have to live with this condition lifelong. However, and only rehabilitation is the only option. However, now this is no more true. We are standing here to let you know what is new, what is different, what has changed over the last 10 to 15 years in the treatment of neurological conditions. So, what is new? Earlier, the old thinking, the old dogma was that once the brain or the nervous system is damaged, nothing can be done. It is irreparable, it is irreversible. However, these are old concepts. This was an old concept, an old thought. What is new is that yes, there is a possibility that brain damage can be reversed with the help of cellular therapy. And that is what we are going to understand more. What is cellular therapy? How does it replace? How does it regenerate? How does it renovate the brain? So, old view was in a neurological condition once diagnosed, you have either medicines to reduce the symptoms, or you have rehabilitation to help get the best potential of that individual or child. But the new view is you do have rehabilitation, yes, that is an important part of a treatment of neurological condition, but now you have stem cell therapy, you have cellular replacement. You can use cell therapy or stem cell as a raw material to help the rehabilitation, and in addition now we have the integrative therapies. So, stem cell therapy and integrative therapy along with rehabilitation therapy makes the triad and the possibility of reversal of autism and cerebral palsy. So, many parents come and ask us, is it possible to reverse? Is it possible for my child to lead an independent life? Yes, it is possible by a combination, by a holistic approach, by treating the child as a whole and not as a patient of cerebral palsy or autism, as a whole along with the family. So, that is what we are looking at. Today we are going to talk and understand about this holistic approach. So, what is this? You must be thinking, I am talking about neurological conditions and suddenly I am showing a bone which is fractured. I think this is a common sight, and you must have seen, either maybe experienced this kind of a fracture or maybe a fracture in the hand. So, we know the treatment for it, right? If there is a fracture of the leg, do we start rehabilitation or strengthening the muscles immediately? No. First we need to fix the fracture, and then after fixing either with a cast or with screws and plate, then only you start doing rehabilitation on therapy to strengthen the muscles around that fracture to be able to walk again. Suppose there is a fracture and you start doing therapy or rehabilitation on walking immediately, what will happen? It will worsen the fracture. Similarly for brain, if there is a damage in the brain, we need to first improve the damaged part, we need to heal the damage, and then the rehabilitation will work better, and that is the role, or that is the focus of regenerative medicine. Stem cell therapy, a tool of regenerative medicine, is here to bring person's individual from hopelessness to hope, from wheelchair to standing and running. So let us first understand what is stem cell therapy, what does it actually mean. Okay, stem cell is like a stem of a tree. A stem of a tree, when you give water, fertilizer, gives rise to branches and leaves and flowers and fruits. Similarly, there are cells in our body which multiply many fold, and depending on what kind of environment you give them, if you put them in the liver, they can become liver-like cells. If you put them in the heart, they can repair the heart. If you put them in the bone, they can repair the bone. If you put them in the brain, they can help the brain regenerate, and that is the potential, that is the strength of a stem cell. So stem cells have different functions. What are the functions here? They multiply. First of all, they multiply. One cell multiplies into many thousands of cells. Then they convert into different types of cells depending on where you put them. They improve blood supply in that part of the organ like liver or brain or heart, and improve oxygenation to help healing, and they release positive chemicals leading to what is called as a paracrine effect, stimulation of that part which is damaged or which is unconscious or functioning less. So they can repair, they can regenerate, and they can replace the damaged tissue. So regenerative medicine, the field of regenerative medicine, stem cell is a tool which helps to repair the damaged part. The normal cells or healthy cells replace the damaged part and reduce the area which is damaged and makes it more functional. Now stem cell can be taken from our own body and given back in our own body. This is known as autologous transplantation, and if we take cells from outside and put it in a patient's body, it is known as allogenic. So taking from donor, putting into the recipient is allogenic. So these are two different types of transplantation. What are the different types of stem cells? Where do we source them from? Okay, do we go and get it from the shop? Can you just go and ask for like a bottle of stem cell? No, these are biological products. These are taken from human body. So depending on where you take them from, we have different types. So we have embryonic stem cells. What are embryonic stem cells? We are all born from stem cells. When we were in our mother, we were one cell stage, and this one cell became 2, 2 became 4, 4 became 8, 16, and we had a bunch of 32 cells. In a bunch of 32 cells, then these start differentiating and then give rise to a whole child in about 6 months, in 9 months. So this bunch of cells are the cells, if they are developed in the laboratory, can give rise to embryonic stem cells, and these are generally produced from in vitro fertilization clinics where there are embryos, waste stage embryos which would otherwise be put into the dustbin, are the source of cells. However, they have ethical issues surrounding them. There are questions whether we are killing an embryo, and so there are human rights issues, plus there is a potential of forming teratomas. So that is why use of embryonic stem cell for clinical transplantation is not really allowed or not a feasible option. Now the second is a cord blood stem cell. We all know cord is something which connects a child to the mother. So when the child comes out, this cord is cut, and this cord contains a whole lot of stem cells, and when it is stored, it is the stem cell for that particular child, can be used in the future. There are different banks which store this. One of the predominant indications for use of cord blood is blood disorders in siblings. So if someone has sickle cell anemia, or someone has thalassemia, or maybe a blood cancer, if their siblings' cord blood is stored, that can become possibly a source of replacement or after a child undergoes chemotherapy. So cord blood transplantation is more indicated in blood disorders. There are certain studies which are happening for autism and cerebral palsy in different parts of the globe where cord blood is being used. Now if you do not have a cord blood saved, then what do? Many people say, oh, we did not know, we could not store the cord blood, or it was an emergency procedure, so cord blood was not saved. So what do? We do not need to worry. We all have potential stem cells in our body which we can use to improve or repair or heal our body, and those are the adult stem cells. Adult stem cells are cells in our body which continue to multiply lifelong. So there are niches in our body like bone marrow, here where blood is formed continuously. So new blood is formed almost every day. So that is a very good source of stem cells and one of the most studied sources of stem cells. Then we also have the fat, a fat which we want to shed, right? Again, that is a good source of stem cells. So there are many sources of adult stem cells which have potential to be used for various indications. So bone marrow, for example, is one of the easiest source of stem cells, can be used to repair the brain or other parts, like for example knee arthritis, or bone damage or unhealed fracture. Bone marrow can be used. So what is the advantage of bone marrow? There are no ethical issues because we are not killing an embryo, these are our own stem cells. This is like a commercial, non-commercial source of stem cells. We are not storing it, we are taking it fresh from the bone marrow, and it does not have the potential to form tumors. That is one of the most positive and safest option for clinical medicine, and hence at Neurogen Brain and Spine Institute we use bone marrow derived stem cells to heal the brain, the spine and the muscles. Now there is a fourth type of stem cells which is being studied in depth, and for which in fact Nobel Prize was awarded very recently, known as induced pluripotent stem cells. These are like designer stem cells. We can take cells from our own skin which are adult cells, which are not stem cells, convert them into embryonic cells which are from our own body, no embryo killing, nothing. So that becomes like a designer stem cell which can be used to treat our own problems. However, this is still in the development stage, a lot needs to be still studied, and hence not available for clinical medicine or transplantation in patients. So at present the best, the easiest, the safest and the simplest source of stem cells that we have, which we can use to treat our brain conditions, is bone marrow. So that is why we choose bone marrow as a source of adult stem cells, because it is safe, we are not killing an embryo, we are not taking it from somebody else, it is non-tumorogenic. Tumor formation has not been published anywhere, and we ourselves have been doing treatment for 13 years, having treated over 11,000 patients, have never seen a patient having tumor. No rejection issues, these are our own cells, no rejection, no negative, easily obtainable using a very thin needle, no cut, no stitches and no ethical issues, because we are not killing an embryo. So adult bone marrow stem cells becomes a very good source of cells for treatment of neurological disorders. Now they can be injected in different ways. We can inject into the IV, like saline. When we inject these cells intravenously, they go through the veins and through the heart, through the lungs, again through other part of the heart, and then it goes to different parts of the body, and very few will finally reach the brain. Most of the cells will get trapped in the lungs. Though it is a very simple way, very easy way, however efficiency, how many cells reach the brain, is very limited. So that is the easiest way. The other way, some people ask me, why can't we directly inject in the brain? We can directly inject in the brain, maybe that will be more efficient, however it would be very risky, because we are going into the brain through normal part of the brain as well, may damage a normal brain, and there is risk of death in such procedures. So giving cells intravenous is simple, it is safe, however not efficient. Giving cells into the brain directly may be efficient but extremely risky. So we found a middle ground, injecting into the spinal fluid in the lower back. So when we are injecting into spinal fluid, we are reaching directly to the brain via the fluid which goes all around the brain and spine. So we are not going into the brain directly, so no damage, but we are going directly near the brain and hence more efficient. So simple, safe and efficient. So what is the scientific basis of the stem cells? Was it something which was discovered yesterday? No. there is a whole lot of research which has been happening over 50 years about stem cells. This we know from the Nobel Prize which was awarded to stem cell research at 3 different points in history. The first ever Nobel Prize awarded was in the year 1990 to Dr. Thomas for in fact the demonstration of stem cells in the bone marrow. So, if we say 1990, then like about 30 years, 30 plus years since the Nobel Prize was awarded, and you can well imagine how much research would have gone even before the award was given. So, maybe at least 10-20 years of work which has gone into this. So, about 50 years of experience or research in the field of bone marrow stem cells. And the second was awarded in 2007 to Sir Martin Evans for the isolation of embryonic stem cells in mice. That was a landmark in itself. And then in 2012, we have the mature specialized cells known as induced pluripotent stem cells from mature cells, reprogramming of these mature cells to become immature cells. Two scientists, Professor Yamanaka and Professor Gurdon, were awarded. So, 3 different Nobel Prize in the span of like maybe 20-22 years. No other field, whether in science or medicine or physics or economics or even literature, has been awarded Nobel Prize for the same field or same type of research anywhere. So, this is a landmark in itself. What is the scientific basis of the work that we do in Neurogen? In Neurogen, everything that we do is evidence based, it is published, it is analyzed systematically, and what we have done in 13 years has been published not in 1 or 2 or 3 or 4 publications, but in 106 scientific publications. So, our work in autism has been published in 16 publications, 2 case series and about 14 case reports. Cerebral palsy, 15 publications, intellectual disability, 4 publications, muscular dystrophy, 18 publications, and about 100 plus, which shows the amount of work that we do. These are peer reviewed, that means people in our field have reviewed what we have submitted to them, looked at the authenticity, looked at the credibility, and then allowed it to be published in scientific journals. So, that becomes a very important or a valid work, that it indicates a very valid work. So, 106 scientific articles in national and international peer reviewed journals, multiple book chapters. We are invited to write chapters as specialists, as experts in the field. For example, in a book on recent advances in autism, we were invited to write a book chapter in this textbook on stem cell therapy in autism spectrum disorders. Then a book named Cerebral Palsy Challenges for the Future, all newer techniques were introduced in this book, and stem cell role of stem cell therapy or possibility of stem cell therapy in cerebral palsy was introduced by us in this book. A chapter in physical disability book, a chapter on muscular dystrophy, and this is Professor Dr. Alok Sharma, our director, presenting a book that we have written on stem cell therapy, neurological disorders, presenting to our Prime Minister Shri Modi. Our Prime Minister was a big supporter of stem cell research and stem cell therapy, went to meet Professor Yamanaka in 2014 to understand about how induced pluripotent stem cells can be used for treating various genetic disorders in India. He came back and he introduced the establishment of a research lab just to study this particular field. He also has contributed to the preface, a book which has been written by us in his language, in local language or state language of Gujarati, on muscular dystrophy. His interest led him to talk about this in the parliament. He spoke about how stem cell research can help to treat conditions such as sickle cell anemia. So, his interest was very evident, and he introduced, very rarely health topics are discussed in the parliament, and stem cell research and the field of stem cell, the interest in that was discussed in 2014 in the parliament, in the Lok Sabha of Indian Parliament. So he really, so there is a lot of government support for stem cell research in India. So how is the treatment done? So parents must be thinking, okay, that's fascinating, all good, but is it very complicated? Is it a surgery? How can I expose my child to a surgical procedure? So the treatment is very simple. It's not a big procedure. It's one needle in the hip bone, one needle in the back. No cut, no stitches. So bone marrow is aspirated using a thin needle. Then stem cells are separated in the laboratory and then injected back into the lower back, into the spinal fluid. So let us look at this video which shows how the bone marrow is aspirated. Okay. So bone marrow is aspirated using very thin needle, then the stem cells are separated in the laboratory, counted for viability, how much we are getting, and then injecting. You can see a very thin needle into the spinal fluid. So no cut, no stitches. 10 minutes of aspiration, 5 to 10 minutes of injection, that is all it takes. So let us look at how autism can be helped with stem cell therapy. But first let us understand what is autism. Autism is a developmental, neurodevelopmental condition where there is problem in certain areas of development. Physically the child looks absolutely fine, however so physically the child looks fine. What we find is there is persistent difficulty in communication, the child has restricted repetitive behavior, problem in vocalization and social interaction. So this is a combination which is seen more in children. This was first described in 1943 by an Austrian physician known as Dr. Kanner, and it is a spectrum. So somebody can have, children can have very mild and some can have very severe condition and some would be in between. So seen more in boys than in girls. Now why do we have to really worry about so much about autism? Why do we need to find a solution to autism? The reason is because it is increasing in alarming proportion. It's like an epidemic which has been there for over 20 years now. So more than that, so we have a COVID pandemic going on since 2 years and we are all alarmed, but we are not alarmed about this pandemic which has been going increasing and there does not seem to be a solution to it or way ahead where we can reduce the numbers. So in 2004 the CDC Atlanta data shows 1 in 166 is the prevalence, and you can see how it has increased in 2018, 1 in 59, and recent 2020 data says 1 in 40. So out of 40 children that we see, 1 would be autistic, and that is like a 1% of the world's population. 70 million people in the world are on the spectrum. Isn't that an alarming number? So it behooves us to find and understand what the problem is and to find a solution to it, and that is where we started looking at, let us understand autism better. What do we know now? What do we know better now? What is new that you are going to learn now? One, that we understand what is happening in autism little better by different techniques that now which we can use, imaging techniques, and as well as a solution to treat that problem in the brain using stem cell therapy. So what do we know new now? We know that there is a problem, there is a fundamental problem in the brain functioning. So you can see here that there is this is a PET scan of the brain. You can see that the green and yellow and red part showing functioning of the brain, which is all right, optimum and maybe slightly more. However, the blue part are the areas which are functioning less. The blue part shows less functioning brain, and these are the areas which are the culprits for the child's condition. So what do we have? Cerebellum. Cerebellum is a small brain in the back which is like a traffic police. It sort of controls everything that the main brain needs to do, like fine motor activity, coordination, balance, articulation, the movement of my tongue, the chewing, the pursing, the sipping, all that is because of cerebellum. So basically cerebellum controls all that the brain needs to do. Imagine that on the crossroad there is no traffic police. What will happen? The road is there, vehicles are running, but there is no traffic police, there are no lights. There would be a jam, there would be chaos. That's what is happening in the brain of a child with autism, because there is a cerebellar dysfunction. Cerebellum, certain parts of the cerebellum are functioning less than the mesial temporal, which contains the hippocampus and amygdala, important for understanding, learning, comprehension, logical thinking, abstract thinking, emotional expression, socialization. Okay, so all this understanding we have compiled and published in a paper which was in World Journal of Nuclear Medicine, the baseline study in autism. This is an original data, and once you have understood, we will look at the management. So management is not just one thing that will help the child. It is a complex interaction of multiple things which will help the child. So it's a team effort, it is a multidisciplinary management. So we have applied behavioral analysis, occupational therapy, physiotherapy, speech therapy, special education, art-based therapy, aquatic therapy, biomedical treatment, hyperbaric oxygen therapy, neurofeedback, and to hold everything together, the stem cell therapy. A little bit about neuro-rehabilitation, because neuro-rehabilitation is the mainstay of autism treatment. We of course have applied behavioral analysis which helps us to understand the behavior of a child, why a child does a particular thing, and how we can prevent it or stop it. So ABA, then physiotherapy, though physiotherapy is generally not routinely practiced for autism at Neurogen Brain and Spine Institute, we do include physiotherapy in the multidisciplinary management of autism. The reason, because the children generally have a low muscle tone and have coordination issues, many a time flat feet, and that is why physiotherapy becomes very important. Then occupational therapy, of course, and sensory integration therapy, very important to teach the child life skills which the child is not able to learn by himself or herself. And sensory integration therapy, to help the child to understand how to integrate the senses, how to respond to light, how to respond to sound appropriately, how to respond to touch, how to respond to holding, and how to respond to smell appropriately. They do respond, but either there is a hypersensitivity or there is a hyposensitivity, and that is why it is important to teach the child how to respond appropriately. So this is the sensory integration room at Neurogen. Speech therapy, earlier it was thought that only speech training is important, only language is important, but now we know that communication training is a complete, it's a package. It's also about swallowing, it's about oromotor movements, it's also about non-verbal communication, it's also about training the parents how to train the child. This is speech therapy being done at Neurogen. Aquatic therapy in the water. Many children and most children love water, and they have fun in water. It's like doing fun activities in the water and learning at the same time, learning how to control the body, how to have a better posture, how to respond better, how to have a better focus. Art-based therapy, learning with fun, learning with music, learning with paint, learning with drawing, learning with arts, learning with dramatics. Then medical treatment, removal of heavy metals if heavy metals is very high, using various chelation methods, giving supplements, vitamin B or vitamin D, omega fatty acid, vitamin C, probiotics. Diet and nutrition, gluten free, casein free diet can be applied, mainly avoid high refined sugar or sugary articles, chocolates, biscuits, food having additives and pesticides, hard to digest food, give more probiotics, give more vegetables, if possible gluten free and casein free diet, camel milk helps, and give more fermented foods. So what is our experience of using stem cell therapy with a combination approach with rehabilitation and now integrative therapies? Our experiences of over 3,500 patients, and broadly our analysis in about 700 patients has shown 90% success rate, where about 10% may not show any improvement, however 90% show improvement to various degrees, some 25%, some 30% will show moderate improvement, 33% will show significant improvement. Then different areas, improvement in different areas, that hyperactivity reduces, understanding improves, cognition improves, sitting tolerance becomes better, eye contact improves, communication improves. So, the first time ever the proof of concept of how stem cell helps in children with autism was published in Stem Cell International Journal by Neurogen. So, first time this we have the accolade in the year 2013 to have this to have done this original research. So, first time ever in the world in 2013 where we showed that stem cell therapy works in autism. We showed that brain scans can help to understand the prognosis, that here you can see in the brain blue areas before the treatment have become less, the brain is healing now. Here again you can see blue areas improving, green means better functioning brain. So, this is before the treatment, after the treatment. Again you can see here more the blue areas here before the treatment and green areas here, the blue has become less. So, 6 months at least it takes to see the changes in the brain. This is using the PET scan. Another example where you can see over a period of 2 years how the brain has improved. Before the treatment you can see that the blue areas were a lot and it reduced and then further reduced in the next year, and even the red and yellow became lesser. So, harmony was developed in the brain where the low functioning areas became better and hyper functioning areas became less. It happened over a period of 2 to 3 years. Another article recently was published in the year 2020 in American Journal of Stem Cells, where the extension of our previous study with more number of patients, 254 patients over a period of follow up of about 7 to 8 months, minimum follow up of 7 to 8 months were studied, and we saw improvement in different areas of the child's development. So, aggressiveness reduced, hyperactivity reduced, attention concentration improved, stereotypical behavior reduced, social interaction became better, eye contact improved, communication and speech improved. Clinical outcome measures, ISA and CARS, which is generally used to understand the clinical condition, also showed significant improvement. Then based on the severity we found equally good results in mild, moderate autism. Age, definitely earlier you treat, better the results. This is one of the most important messages that came out of this particular study that we did, that those who are less than 5 years, almost 98% of the patients, 98 to 99% show improvement or reversal. Between 5 to 10 years when a child comes to us, there is a 94% chance of improvement, and as they grow older, 10 to 15, about 90%. So, as the age increases, the possibility of success keeps reducing little by little, because the brain is more compliant in the early age. Later age, hormonal imbalances become very difficult to manage, whereby the brain development is you cannot really pay so much attention to improving the brain functioning, or the hormonal changes actually confound or camouflage the effect that we are having with the stem cell therapy. So, gender, so depending on male or female, if you look, equally responsive in terms of stem cell treatment. So, stem cell treatment works equally for girls as well as boys, and how soon they come to us after diagnosis. If they come to us before 1 year, we see improvement in 100% of the patients. If they come between 1 to 5 years, 95% is the success rate. If they come later than 5 years, about 90% is the success rate. Now, if you look at the review of literature, if you look at what is the evidence which has been collected over the years in various parts of the world, we see that the first paper, as I said, came from India, from Neurogen, the second came from China, the third came from Italy, the fourth came from US, fifth from US, sixth from India, seventh from Panama, eighth from Vietnam, ninth from Iran, and 10th from the US. So, 3 publications from 2 publications from India, both from Neurogen, and the rest of course from the rest of the world. So, there is enough evidence to show that stem cell works with a minimum or no side effects. 16 scientific publications from Neurogen, and let us see a few examples of how improvements can be seen. Now, this is a child from United States of India. He came to us when he was 10 years old, and mother tells us how was he initially. The mother found that there was a reversal, there was a regression in the child initially in the first 2 to 3 years. He was all right up till 18 months to 2 years, and then he regressed. And father is a doctor, mother is a nurse in the US. He got the best of therapies. He was in a special school. So, the father did all the research and found that yes, India has a solution for his son. He, being an Indian himself, had full faith in us. He came here, he did the treatment, and we saw amazing results in this child. And the mother will tell herself that eye contact improved, he engaged more with his peers, with his brothers. He was much more calmer, his mood swings were less, he started enjoying water, he started his sensory issues reduced, he started wearing full clothes, his understanding improved, his reading improved, PET scan showed improvement, the brain started becoming healthier. So, you can see here the PET scan, the blue areas after the treatment, they have improved and blue areas are lesser, green is more. The green indicates good and healthy brain. And his reading level went up from 3rd grade, 4th month to 7th grade, 1st month in 5 months. Okay, that's amazing. In 5 months, there was like a 4-year improvement in terms of reading, and apart from that, he excelled in all the subjects in his school, and he went on to go into a normal school. His speech is near normal, behavioral issues have reduced. So, amazing improvement, shifted from special school to normal school, got A grade, and he knows English and Spanish as well. He can speak. An example from Kenya, this is a story of triplets and the amazing courage of the parents, especially the mother. So, they were, because they were triplets, they were premature, they were younger. When they came to us, were extremely hyperactive. Okay, they would run around everywhere. We had to clear the room so that we are not they don't destruct the TV or the fridge, so that they have space to run around, and you can see they would run away from home, and they had a whole lot of problems, and slowly and steadily these children are settling down. Hear from the mother herself. So, mother researched, she understood, she met Dr. Sharma in Kenya, and she was convinced that this is a treatment, and that when she came here, she found not only stem cell therapy but support of another family. So, these children have already undergone stem cell therapy twice, and we can see that amazing improvements. You can see stem cell being separated and injected, beautiful stem cells like rosy stem cells and healthy stem cells injected back into the spinal fluid using a very thin needle, and these children showed rapid improvement. One of the boys started, performing all activities, brushing his teeth, having a bath, wearing clothes by himself, all the bad habits of defecating all their clothes, everything, spitting, all that became lesser. They are just more involved, they can eat by themselves, they sleep better now. More manageable, and they are growing in academics as well as their activities in daily, cycling better, coordination has improved. You can see that this is something we typically see, that balance and coordination improves very fast, and children who could not stand on one leg are able to stand, able to do skating. There was a child who was able to learn skating after the stem cell therapy. So something really activates or changes in the brain, that the brain becomes more available for any kind of teaching. Grasping power improves the child, the brain is just more pliable and more trainable. So that is why rehabilitation after stem cell therapy becomes very, very important. So now Ricky, one of the triplets is logical thinking, understanding, sensibilities, sensitivities, all has improved, and he is improving day by day. So the stem cell forms a very good platform for the later development of the child. So earlier you bring the child, better the results. So you can see here, this is a 7-year-old going to the shop and buying items and exchanging the money and going so confidently. So that's the power of stem cell therapy here. So this is another child from 13-year-old, came from Kenya, and for 13 years he was practically locked inside the home, extremely hyperactive. And he came to us very difficult, would really remove his clothes and run out of the house. After stem cell therapy, he went to a home in Africa, South Africa, where he was given good rehabilitation, and with stem cell and rehabilitation, child has settled down. He learns more. He started vocalizing after 13 years, started saying a few words. He is more manageable. He can do his own household activity. Social interaction is better. He's learned swimming, he's learned cycling, and finally now he can go to school. That's the most important thing. He doesn't need to be at home all the time because he is just more manageable. So we believe that if you can come early, wouldn't it be better? So this is a child from India whom we treated, one of our first children that we treated, who is this video was made a few years back. He's almost 19, 20. He's like I asked his mother, what is he doing these days? So she is saying he's an assistant chef. He helps mother at home in cooking. So isn't that amazing? Amazing. So they found very early on in his life that he was toe walking, and he had apart from autism also had ADHD. After stem cell therapy, his hyperactivity reduced, self-injurious behavior became less, he became more interactive, more understanding, his reading attention became better. He passed, his interaction with his sister became better. He started taking care of his sister. Puzzles, he started solving puzzles, almost 100 bits of puzzles. So amazing improvement in this child over a period of 6 months to a year. He started teaching other children. Mother was a special educator, teaching children with developmental issues such as hearing impairment, and this child actually supervised these children. So isn't that amazing? Interest in dance, interest in listening to music, better interaction with his father, helping mother at home, in daily activities, even cooking, going to a shop to buy items. You can see cooking, amazing. So this is me cooking at home, just on verbal instructions. Goes to market to purchase, actually picks up stuff that he wants. He passed his 10th grade, he passed his 12th grade. Amazing improvements in this child. And an improvement of a non-verbal or a semi-verbal to a verbal child. Just can you imagine looking at this child, that he is autistic or he was autistic. He came to us from South Africa when he was 4 years old, and then we treated again 5 years, second time, and from a practical non-verbal or a monosyllable speech to a complete storyteller. So this is the journey of Zachary in 3 years. So this is what stem cell can help children in doing, making the efforts of parents more effective. Can you make up a story like he is doing? So now let us look at other disorders. Cerebral palsy. Cerebral palsy is damage to the brain due to lack of oxygen at the time of birth, and the problem could be during pregnancy or during birth or immediately after birth. And there are different types of cerebral palsy depending on which part of the brain is injured. Your one side could be paralyzed, or your both hands and both legs could be non-functioning, or can be everything from neck down can be paralyzed, or there could be lot of involuntary or unwanted movements, or dystonia or ataxia. So there are different types of cerebral palsies. This is the brain which shows damage. You can see the black part is completely damaged, but the blue area around this black part is what is salvageable. We can save this area, stimulate this area so that the child can improve better. What is the general treatment? Medical management, medicines to reduce tightness, to reduce involuntary movements, to control the seizures. Okay. Or if there is too much tightness, Botox injection can be given at the muscle or the nerve level, or there can be surgery to at the tendon level, or there can be surgery in the spine to reduce the spasticity. But all of it does not really address the main problem in the brain, right? This is all external support. So stem cell therapy helps to improve the brain functioning, and in that we see almost 90 plus result, 90%, 91% result in cerebral palsy in different areas. How do we see improvement? From top to down. Okay, in the central part, we see improvement in understanding, in learning, in comprehension, cognition. Okay. Then if you go down, tongue movement, lip movement, chewing, swallowing, neck holding, first of all neck holding, then sitting balance, then standing and walking, then hand functioning, tightness reduction. So these are the kind of changes that you see in cerebral palsy after stem cell therapy in combination with good rehabilitation, very, very important. So when you look at the brain, what do you see? You can see the brain here, the blue areas and the black areas. The black is dead, but the blue is functioning less, and after the stem cell therapy you can see that the blue area has become green. So that means it has got activated, and that is the part which is going to help us recover the function. Again you can see example here, you can see the blue area here, and after 6 months you can see the damage is better. It takes 6 months to see this improvement. Again you can see here and here the blue area has become activated. Then you can see all these blue areas, you can see is recovering, though not complete, maybe in the first time, we may need to do another time, but the brain is becoming activated. Again you can see here before and 6 months later, 6 months later. So this is again published data. We have published in 2015 stem cell therapy in cerebral palsy, and also almost 15 scientific publications on cerebral palsy. So let us see a few improvements. Now this is again a child from Kenya who came to us, 7-year-old boy who he could not even stand. He needed complete support before the treatment. After the treatment you can see slowly started walking with a walker, and then here you can see independent walking. So this you can see here at home he is walking without support. Isn't that amazing? So apart from that, cognition, understanding, speech, chewing, swallowing, all that has improved. So physical improvement from not even able to stand to walking in about 2 years. This is a story of another child from Kenya, came to us when he was 14 years old. He was wheelchair bound when he came to us. With stem cell therapy, slowly he regained muscle power. He learned how to sit, he learned how to wear his t-shirt, which he had not learned in 14 years. He learned how to pack his bag, he learned how to use mobile and then get up and go to the fridge, take out a bottle of water and drink, unscrew it. So these are daily activities he needs so that he can be less dependent on his parents, and you can see him from wheelchair to walking. Let us look at now intellectual disability known as mental retardation. So what is intellectual disability? That the development of the individual's intellect, understanding or cognition is less, so that an individual is not able to lead an independent life. So, again PET scan you can see the blue areas are damaged, and here we have about 84% success rate in intellectual disability, and improvement in areas of cognition, remote memory, problem solving and understanding of relationship and social inhibitions. You can see the blue area, the damaged areas are recovered in 6 months, they become green, the brain is activated. Again, the first ever publication or evidence that stem cell works in autism is was published or was shown by Neurogen Brain and Spine Institute. Let us look at the brain scans. You can see the blue areas here, it looks, the above part looks like as if the brain is absolutely sad and eaten up by the mouse. The brain is like really unhappy, right. After the treatment in 6 months you can see a brightening or a lot of green and yellow areas. So, brain is activated. So, that is what the stem cell therapy does, activates the brain functioning. Again you can see blue areas becoming green, blue area becoming green. So, activated brain. Again evidence in terms of publications, 5 publications from Neurogen on intellectual disability. Let us see an improvement video of a 26-year-old intellectual disability. This girl's name is Pratibha. Pratibha in Hindi means talent. So, this is a girl who is very talented. She discovered her talent after stem cell therapy. Before she had even a problem even copying, improved copying after even stem cell therapy. Coordination became better. Physically she looked all right. She started performing instrument at national and international level, dancing. So, these are the talents that she discovered. Cooking, she discovered a passion for cooking, and she now works in a cafeteria which is run by individuals with special needs. So, she has now a profession to look forward to. So, isn't that amazing? So, this is how the brain helps even at the age of 26, if this was possible. Of course, a lot of efforts from the parents' side, but if we are able to start this process early when the child is young, you can achieve so much better. Muscular dystrophy, a condition of the muscles where the muscle is weakening day by day, and here there is a special kind of muscular dystrophy specific known as Duchenne muscular dystrophy, where a boy or an individual may lose his life between the age of 18 to 22 years. Here the muscle degenerates and we can see that hardly any muscle remaining at the age of 21 years. In muscular dystrophy, the main aim of the treatment is to stop deterioration or to control deterioration. Stem cell treatment is not a definitive treatment. We can't remove the problem from the root, but we can improve the quality of life of the patient. We can see here individuals who received children who received stem cell therapy, they stopped walking much later than children who did not receive the stem cell treatment. So, muscles show better improvement, the electrophysiology or EMG reports show improvement. Again, we have 18 scientific publications in muscular dystrophy. This is a child who came from Turkey after stem cell therapy at the age of 9 years. You can see that he came to us when he was like 5-6 years old, and 9 years he is still walking. He came to us now at the age of 14, he is still walking. These children generally stop walking between the age of 8 to 10 years. With stem cell therapy, we have been able to delay the complications, make him more stronger, make him at least be able to study, be able to continue his daily activities with minimal or no support, delay the complications. So, ability to get up from the floor, ability to stand, all that improved in the first 6 months after the treatment. You can see here earlier he was not able to get up at all. After the treatment, you can see that his attempts are much more fruitful. Another child from Kenya came to us at similar age of about 5 to 6 years, and difficulty in climbing stairs, difficulty in walking, started walking better with more ease, running, riding a bicycle, climbing stairs. So, all of that improved after stem cell therapy. He is also about 14 years old and is able to walk with difficulty, however, is still walking with some support. So, this is basically the downward trend is somewhat slowed down and stopped. Like, let's look at Down syndrome. Lot of children with Down syndrome, it's a chromosomal condition where instead of 2 chromosomes, chromosome 21 is 3. So, anything more is also not desirable. This syndrome has multiple issues. There could be the the eyes are not proper, ears are small, there is a flat occiput, tongue problem is there, sometimes short neck, height does not increase. They could have thyroid issues, cardiac hole in the heart or cardiac issues, sometimes hernia. So, whole lot of apart from brain, lot of other problems as well. Those areas have to be taken care of by the individual specialist. So, if there is a gastrointestinal problem, then surgical treatment. If there is a heart problem, surgical treatment. If there is a endocrine problem, then medication. So, brain functioning is what stem cell therapy can help in improving. Though there is no cure, we have looked at a few children and found good results where when we do the PET scan, we can see that these are certain areas which are functioning less, and after 12 months after the treatment, you can see there is a improvement in the brain functioning. Again, here you can see the blue area becoming green, suggests improvement in brain functioning. So, let's look at a video. This is a 12-year-old girl who came to us from the north of India, who was going to special school, getting all rehabilitation, had problem in motor functioning as well. So, tone of the muscle is low. So, generally these children are not able to run, jump or do physical activities appropriately. Understanding cognition is low. So, after stem cell therapy, she started improvement in puzzles, solving, learning, motor activities and speech also. One of their main problems is the the tongue is very thick, so the speech clarity is not there. Many children are not able to speak also. So, speech clarity improved in this child as well. She started helping the mother in kitchen activities. So, a whole lot of improvement in various domains, socialization, dancing. In fact, I have met her in her home and she is doing fabulously. So, speech before the treatment was not clear, which was one of the main concerns, and now she speaks a lot. You will see. Started speaking numbers clearly, started learning things. So, she can tell now days of the week, she can count, she can do additions. Spinal cord injury, when there is a damage to the spine leading to neck down paralysis or hip waist down paralysis. About 1000 patients treated with thoracic spinal cord injury, where from waist down patients are paralyzed, showing 96% success rate. Those who are neck down paralyzed also show improvement. So, we have 9 scientific articles on spinal cord injury. Let us see an example of an individual with cervical spine injury. This young patient came from Nigeria. He underwent stem cell therapy about a year back. He met with a traffic accident in 2020 May. He came to us soon after that in 2020 November. Earlier he could not even turn or sit. You can see the difference yourself. Before the treatment, he had to be lifted with after stem cell and good rehabilitation. He is able to shift by himself. His legs were extremely tight. They were deformed. Now with stem cell and rehabilitation, he is able to straighten his leg much better, much easier. He is able to control his trunk much better. You can see earlier he needed so much support. He was able to perform these activities. His hand function, because he was neck down paralyzed, his hand functions were also affected. They improved. His sitting balance improved. He can sit without hand support very comfortably. Now he can stand with support. He can now walk with a walker with support. So a person who was neck down paralyzed. So this is a gradual improvement, right? Before he had needed so much support to stand, now back support wasn't required. Slowly started training him on the parallel bar. He could in 25 days he could stand on a parallel bar with less support. So these are gradual improvements, and he started holding pen and writing. Then he went back to Nigeria, and then he continued good rehabilitation there. And when he came back recently, he is showing beautiful improvement. He can use computer keyboard, and now he is planning to go back to studies. He's a student of geology. Brain stroke, one of the most common neurological conditions. Almost 35 million people in the world are affected by brain stroke. Again, our analysis shows 90% success rate in brain stroke patients. You can see brain before the treatment, lot of blue areas. After the treatment, the blue areas have reduced. So brain functioning has started coming up or improved. 6 scientific publications in stroke. Let us see one video of a young individual, just 24 years old, with right hemiparesis. So right side of the body is paralyzed. After treatment, hand function started improving, which is one of the main cause of concern in stroke, which usually doesn't improve. Hand function, using the hand, vocalization, balance. So all of these things improved after stem cell therapy. Gait became better, climbing stairs. So an individual whose life had stopped has restarted now. So if we treat early, even younger patients can come back and get rehabilitated completely. Cerebral ataxia. Ataxia means a small brain. The part here is shrinking and leading to incoordination and balance issues. It is a progressive condition. Individuals who have ataxia continue to deteriorate and at some point stop walking, have speech issues, swallowing issues, and may have aspiration. So you can see here the brain functioning, the small brain is shrinking after the treatment. The brain functioning has improved. We will see one video of a patient who came to us from the US. She was completely wheelchair bound at the age of 24 when she came to us. Her sitting balance improved, her shifting improved, even with a whole lot of movement. She came on a wheelchair, and in a couple of years now, the father has donated her wheelchair and she is able to walk with a walker or a rollator. So this is a gradual development. It needed multiple stem cell treatment over a period of 2 to 3 years. She is a swimmer in Special Olympics, having won bronze as well as silver medal. So this is accomplishment which she could do with the help of stem cell therapy. Head injuries, similar to spinal cord injury, if there is an accident or a trauma, there is a brain injury leading to death of certain parts of the brain. Again, in traumatic brain injury, we have a good improvement of almost 95%, an improvement in different modalities. Mainly you can see here the brain functioning before the treatment, and after the treatment the brain is just more better in functioning. You can see here lot of blue areas, it's becoming green. So all the blue areas may not get completely salvaged. You can see here a gap here, that is the black part, there is nothing there. So that is not going to repair, but what can repair is the light blue areas. We can salvage those areas to function better. Again a publication. So all that we do is analyzed and published, and you can see 2 scientific publications in traumatic brain injury. So these are a few examples of conditions that we treat. Let's look at side effects or complications. That is one of the concerns of caretakers and parents. No major side effects with stem cells that we use. These are autologous from your own body. No major adverse events or no neurological deterioration, irreversible deterioration. Minor issues could be headache, nausea, vomiting. Headache because of spinal headache. This is a reversible headache. Within 2 to 3 days it becomes alright. Epilepsy in 3% of patients who have a history of seizures or whose EEG is abnormal, there is a possibility of transient increase in seizures over 3 to 6 months. So, we looked at stem cell therapy, we looked at rehabilitation. Now, the third advancements, that is the integrative therapies. What is integrative therapies? Basically, integrative means we can integrate this with the stem cell therapy and make the treatment more effective. So, what have we brought as a combination? We brought hyperbaric oxygen therapy, ozone therapy, gut cleansing, acupressure or deep tissue mobilization, and intravenous vitamins and micronutrients. This differs for every individual based on the condition. We would suggest what needs to be done here. So, hyperbaric oxygen therapy improves oxygenation throughout the tissues. We normally, what we are breathing, the air is 20% oxygen, right. So, this is at normal atmospheric pressure. In hyperbaric oxygen, the chamber that you see here, the patient, if there is a small child, patient with the father or mother, or if it is an adult, will go inside this chamber and will be exposed to 100% medical oxygen at increasing pressure, starts from 1.3 atmospheric pressure, goes up to 1.75 to 2 depending on the need. So, every session the pressure is increased. About 10 to 20 sessions minimum helps the cells to be exposed to more oxygen. This is how the treatment is done. Child is comfortable inside, happy looking at the video or the cartoons which he can see, and you can see here what happens normally when we breathe. The red blood cells will carry the oxygen. However, in hyperbaric oxygen therapy, the oxygen is carried not only by the red blood cells but also diffuses into the liquid part or the plasma of the blood. So, it diffuses throughout the body right from here to the toe. So, benefits are strengthens the immunity, stimulates oxygenation, stimulates the stem cells in our body, and what we have injected improves metabolism, increases energy level, reduces fatigue, and improves overall functioning. So, along with stem cell becomes a very good adjuvant to stimulate the stem cells and the brain. Ozone therapy, another form of oxygenation or oxygen therapy. Ozone is basically an addition of one more molecule of O to the oxygen O2. So, O2 is 2 oxygen molecules while O3 is 3 oxygen molecules, and that becomes an activated oxygen, super strong oxygen, and when it goes into the body, again it is an unstable molecule, divides into an activated oxygen molecule which kills the bacteria, kills fungus, kills viruses. That means it acts as a germicidal. It reduces inflammation and swelling, reduces blood clots, thins the blood and causes more blood flow into various organs, acts as an antioxidant, in general stimulates the stem cells in our body and what we have injected. So, this becomes a very good adjuvant source to be done together with stem cell therapy. There are different ways that ozone can be introduced into the body. One of the simplest way is as a like an enema through rectum or through the ear. So, again as we said, it is all the different benefits are strengthens immune system, kills bacteria, viruses, on contact detoxifies the body, reduces inflammation, anti-aging, increases energy, increases oxygenation. Gut cleansing, basically we are what we eat, isn't it? So, if we have eaten a lot of not very good things over years, it gets all accumulated in our gut. We are not able to really cleanse it completely. So, a lot of muck in the gut cleansing cleans up all this muck. So, it also helps to improve the nutrition and strengthen the immunity. And this colon hydrotherapy generally for the adults and not for the children. Acupressure or deep tissue mobilization, basically pressure points in our body helps to stimulate angiogenesis and increases, also helps the child or individual to relax. How does it work? It relieves muscle tension, activates body's self-soothing mechanisms, improves blood circulation. Vitamin therapy, depending on the need, intravenous or intramuscular or oral, vitamins are given and it helps to improve the immunity. micronutrient therapy as required. So, at Neurogen Brain and Spine Institute, this is Neurogen Brain and Spine Institute, Navi Mumbai, India, where along with our sister concern, that is KLS Center for Anti-Aging and Integrative Therapies, we have treated over 11,000 patients from 70 different countries. The core Neurogen team is made of specialist senior members, including Professor Alok Sharma, who is a neurosurgeon and director, myself, Dr. Nandini Gokulchandran, the deputy director and head of medical services, Dr. V.C. Jacob, the head of neuro-rehabilitation, having over 60 years of experience in neuro-rehabilitation, Dr. Prerna Bade, our regenerative specialist, who is the actual hands behind the stem cell separation, and Dr. Himangi Sane, our physician as well as the head of research and deputy director, who is herself a patient of motor neuron disease and a recipient of stem cells. So, this is the experience behind Neurogen, a combination of all different kinds coming together as a team. Our infrastructure, we are in a place known as Navi Mumbai Sea Woods, located very near a beautiful lake. We have in our center state of art operation theatre and a state of art stem cell laboratory, where the stem cell separation is done within the operation theatre complex. So, nothing goes out of the complex, so no infection. Then these are the stay facilities where we take care of our patients like our own family, and a comprehensive neuro-rehabilitation under one roof, about which I spoke. So, it is a team effort, a combination of stem cell rehabilitation and clinical specialists. Neuro-rehabilitation works as a fertilizer for the stem cells. So, these are our different departments: rehabilitation, physiotherapy, adult, occupational therapy department, autism child development center, especially for autism. Neurogen has published over 18 books, some for caretakers and parents, some for professionals, and this is freely available online as freely downloadable PDFs. We are accredited with GLP, GMP and ISO, we have ISO certification, and we have received a lot of awards, national as well as international, for the various work that we have done over the years. So, at the end, to help you make a decision, please do look up our website www.neurogenbsi.com or email us at contact@neurogenbsi.com. We will get back to you as soon as possible, and we can set up an appointment for discussion with our doctors. Once you have decided, a coordinator is appointed who will help you with all the logistics till you reach us. We have a 1-week program and a 2-week program based on what options you want to include in your treatment plan. In conclusion, adult stem cell therapy is considered as a safe and effective treatment. There are no long-term side effects, and in general almost 90% success rate for autism, cerebral palsy and many other pediatric and adult conditions. So, this is a journey of hope, a combination of cell therapy, rehabilitation and integrative therapies, leading to a functional independent life. Thank you for patient hearing, ending with this amazing speech by President Obama, who in his milestone or a landmark speech lifted the ban on federal funding for embryonic stem cell research in the US in the year 2008. And where he showed faith in what stem cells are. So, two of the biggest democracies in India are supportive of stem cell research and treatment. So, this is an important thing to keep in mind, important because lot of negativity or misgivings about stem cell research and therapy is floating. It's important to know, it's important to be educated, it's important to know what the reality is, and I hope that with this webinar and this seminar we have been able to put forth in front of you the real evidence which will help you make a decision for your patients. Thank you for listening to this webinar and seminar, and I hope that this seminar has helped you understand the concept of stem cell and what it can bring to your patient's life, to your children's life. I hope this has been an eye-opener for you. Feel free to reach us at Neurogen BSI. You can email us at contact@neurogenbsi.com or reach us at +9199 20 200 400.